a general practitioner, to shed light on the hidden health risks of energy drinks. Dr. McKay, appreciate the time, appreciate it this morning. How dangerous is probably the most basic of questions here. How dangerous are energy drinks?
Yeah, in short, the answer is they are dangerous. You know, the problem is we don't know, well, the amount of caffeine that's in there, the large amount of sugar or sweeteners that's in there, but there's also a lot of what we call these, someone's calling them sneaky stimulants or sneaky sweeteners, the things that we don't know much about, things like taurine, if you look on the cans, guarana, L-carnitine, which are all, the additive effect of that can have gross health consequences. And we're seeing that not so much us as GPs, but if you talk to the emergency care physicians, those who are there in trauma, the amount of young people who are coming in late at night with heart problems, with neurological problems, with seizures, with all sorts of behavioral disorders, manic, bipolar, as a result of the overconsumption of these energy drinks, I would say they are, in my opinion, they are extremely dangerous if not used correctly.
I'm actually wondering, because you just, in that final answer right there, you've used the word overconsumption. Is there a safe limit to consumption of these energy drinks even?
So the marketers will tell us, and some of the literature will say, yes, you know, there's probably no harm in a can here and there. If you're having a bad day, you just need some extra focus, a bit of concentration, extra fatigue. The problem is, as you mentioned in your intro, young people who are looking for extra performance, those in the sports arena, they tend to use it. They get a good effect from it. And what happens then, they tend to start using it more and more regularly. Their sleep patterns become disrupted. And so you have the issue of now dependence. We have the issue of the heart rate going up persistently. You have the issue of hypertension then developing, even obesity with the amounts of sugar. The effect on the neurological system is deleterious. So the combined effect of enjoying it, seeing some sort of effect and benefit in inverted commas, as it were, leads to that overconsumption. And of course, we're not even talking about what about addiction and then becoming dependent on it and then needing more and more of it to get the same effect.
I think, Marlin, and again, it's Iman speaking, welcome to the program. For anyone who's watching, especially those who have children in their care, you're saying in any quantity, these are dangerous things. You mentioned some crazy chemicals, chlorine, guarana, I can't even pronounce the last one that you said. But there's a lethal, seemingly a lethal cocktail of products and chemical byproducts in these products. Why are they legal in South Africa if they possess such a high health risk? And also, why do they not come with warnings?
Yeah, absolutely. So this whole industry, unfortunately, is not regulated. And again, in my opinion, young people should not even be using it. And you see their children. What about the effect of still mixing them with alcohol that we are seeing? So it's not regulated. We don't even know, and especially the small print, we don't know what the exact quantities of these extra sneaky stimulants that are in there. Look, the caffeine is marked in bold, which is excessive. The amount of sugar is marked in bold, but the smaller print, we are not too sure. And so it doesn't go through the proper regulation. And this is worldwide. There's data coming now from a good paper, a systematic review from even from Italy that shows the gross abuse of this, that young people are coming to the emergency rooms with cardiovascular, cardiac arrest, some of them even being fatal. So this is something where the regulatory authorities need to get involved. We need some sort of guidance. We need to make sure that our young people and our children are not using them. And a lot of young people, well, I'm not drinking alcohol, at least I'm drinking this, it's got this and this in, but we don't know about the effects that this is having, probably even more dangerous than some of the other substances that they have access to.
What you also see is the proliferation of places where these products are consumed. You know, you're sitting with your family, having breakfast or lunch somewhere, and, you know, you're choosing a sparkling water or a soda, or you might choose an energy drink as an accompaniment to your meal. So it's becoming so much a part of, you know, sort of common usage. You're saying to everyone in South Africa and beyond, just don't do it.
Yeah, absolutely. This is the message that we need to get across. We need to come back to healthy living. We need to come back to getting what I call getting back to basics. We're not sleeping properly. We're not drinking enough water. What is wrong with just a nice, warm, brewed cup of coffee? Coffee has shown so many benefits. If it's plain black coffee without milk and without sugar, you can have 3 or 4 cups per day. Extremely healthy. We need to be getting enough sleep. We need to be moving away from these as some sort of dependent, as a crutch to try and get through your day, get through the night, get through your studies, get through your next soccer game, whatever the case is. Get back to basics and start bringing back the good old habits of normal eating, healthy eating, getting enough sleep, drinking enough water.
Yeah, some would even ask the question, but doctor, I mean, I even have the sugar-free option, so at least I'm even on the better side. But even that is obviously the other elements of it still remain in that. Let's talk about the role schools, retailers, parents play in curbing the drinking of a lot of these energy drinks.
Yeah, I think there's a big concern coming out from the schools because they can see the effects it's having on the kids, where the kids are dependent on this, they're not getting enough sleep, they're studying through the night, and you see the effect in the exams and the exam results. So parents, we need to start raising a lot of awareness amongst parents. Parents need to know what is in these substances, the dangers. The schools, I think, are already on board. Judging from some of the literature, school governing bodies are expressing concern about the effects it's having on the kids, especially in terms of their behavior, the change, aggression, heart rates. So they are there. And so together we need to work together so that we can stop our kids using these things. And again, even emergency care physicians need to come to the fore and chatting to parents and telling them, this is what we're seeing in the emergency room. This is what we're seeing in the casualties. This is the effect that it's having on kids. So everyone needs to come forward and play a role, get together so that we can minimize the effect. And again, in my case, young people, pregnant people, women, these should not be using these things at all.
I'm going to ask you later, Dr. McKay, about whether all energy drinks are created equal. And just as a disclaimer, in leading up to this interview, we showed a lot of overlay of a number of energy drinks. So we are not in this interview making specific claims about any of those products, but they just fall within the universe of energy drinks in South Africa. But I'm concerned about, we've also seen the proliferation of other conditions. So when we think about co-conditions or existing conditions and the impact on those of energy drinks. I'm thinking of attention deficit hyper disorder, for example. And then you're on, a routine of drinking these energy drinks. What are the amplified risks if you already have some underlying conditions, like you talked about earlier, hypertension and diabetes even?
Yes, absolutely. Again, we are aware of the content of these things. We are aware now of the effects that they have. And the effect can only be exacerbated or exaggerated if one already has an underlying condition. If we know that you have coexisting hypertension, high blood pressure, and you are taking a stimulant, which is going to increase your heart rate, it's definitely going to increase your blood pressure, which is in turn is going to increase your risk of getting a heart attack or a stroke. Simple, straightforward. In the case of kids who have this condition, ADHD or ADD, attention deficit hyperactivity disorder, they are already hyperactive. Now you're giving something that can cause increased palpitations, increased anxiety, make them more hyperactive. You are exacerbating the effect of the underlying condition and just making these kids much more active, less. You're trying to increase the focus, but you're making them more agitated, more irritable, more anxious. And so you are interfering with the control of so many of these things. The same goes with diabetics, all right? It's a lot of sugar, even though they say it's drinking sugar-free, but increases insulin resistance can increase the risk of diabetic ketoacidosis, then going into a diabetic coma. So we talk about if in cases where they have no comorbidities, it is already dangerous, much more dangerous in the case where there is already some sort of underlying condition which can be exacerbated by the effect of the drink.
Yeah, just as a final one, I know you've already said don't do ultimately here, but should there be standardized labeling? And it goes back to a question that Iman asked you a little bit earlier, just with regards to those warning signs on these drinks. Should there be standardized labeling around whether it be caffeine content, taurine, as you made note of, etc., around these energy drinks?
Yes, absolutely. Just like in medicine, we have drugs that have a black box warning. These drinks should have a big warning on this, not to be used under a certain age, and can lead to exacerbation of certain conditions. There should be big warnings on there. But again, we mustn't even depend on those warnings. We should be aware of it. Parents should be aware of it. Governing bodies should be aware of it. Regulatory authorities should be aware of it. But I think that's a good place to start. Just a bold sort of warning about the dangers of these substances in there.
Marlin, we're going to let you go, and thank you very much for joining us this morning. But clearly, there's a whole market for energy. Give us two natural alternatives very quickly.
Water, plain coffee, and get enough sleep and exercise. Just start there. Start with the basics. Our sleep hygiene is so bad. If you get enough sleep, you're not going to be tired. You're not going to be looking for an energy drink. You're exercising, that's the best vitamin, and drink enough water.